Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back to the show, COIQ listeners. On today's episode, we have Dave Johnson with us. He is the CEO for Foresight Health, and he's authored a book called The Customer Revolution in Healthcare that just came out a couple of months ago. Welcome to the show, Dave.
Well, thank you. Delighted to be here. Happy to meet all of your audience.
Yes. So, before we get started, tell folks a little bit about who you are and what you do.
Sure. I've got a little bit of an unusual background, Roxy. I was an English literature major in college and a Peace Corps volunteer in Africa, and thought I wanted to do international development for a career, and went back and got a degree in public policy at Harvard. And one thing led to another, and I ended up as a healthcare investment banker, which would have surprised nobody more than my own 25-year-old self, and I had a very successful healthcare investment banking career working on behalf of large health systems. For the
I bet your parents were surprised from the Peace Corps into that career, right?
Yeah. You know, when I was going into the Peace Corps, my dad tried to, every way he could think of, to talk me out of it. And so when I ended up on a business track, I think he was secretly grateful. So I was very successful banking career, 30 billion in bond issues and so on. It took 25 years. But what I realized was I think what I really am is a journalist. And so for the last 5 years, I've had my own company, Foresight Health, written 2 books, and produced a lot of thought leadership on market-driven healthcare reform. And in some ways, this complex, nuanced industry that we work in, I think sometimes requires literary sensibility, cultural sensitivity, public policy acumen, and market knowledge. And I use all those prisms to think about and reflect and hopefully comment intelligently on the industry. So.
Sure. Yeah, absolutely. It's a very diverse background. So I'm
no kidding.
I'm excited about today's conversation. So how would you describe this roller coaster of healthcare innovation these last few years? What's happening?
Innovation. One way to look at it is there are record amounts of investment from both private equity and venture funding going not only into healthcare services, but into provider-based services. And I think the smart money believes there's enormous opportunity to deliver the right care, right time, right place at the right price by being better, faster, and smarter than the current providers in the system. One of the ways I look at it, Roxy, is if you imagine a 2x2 grid with duration of care on the x-axis going from episodic to ongoing, and then care uncertainty going from low to high on the y-axis, you end up with the 4 boxes. And lower left is high degree, low risk, episodic, so high degree of certainty of a good outcome. That to me is routine or commodity care, and probably 70% of healthcare falls into that bucket. If you go up, which is high risk but episodic, something like a heart transplant, that would be, and then upper right would be high risk and ongoing. That's the real solution shop kind of stuff, complex care, comorbidities, and then lower right would be the non-acute chronic care. And I think health systems and the industry overall, sort of the traditional players, are trying to be good at all of that and end up not necessarily being good at any of it. You've got pockets of excellence. So they're trying to be all things to all patients. And I believe that what the marketplace is doing is picking spots where they believe they can outperform the current system, and it's a pretty low bar in many cases. So you're seeing the rise of these enhanced primary care companies, urgent care companies that are really doing it better, faster, cheaper, with greater customer service. You kind of think about that specialty care, the emergence of high volume focused factories, taking volume out of hospitals, putting it into ambulatory centers with specialized expertise. You think of the lower right, which is the non-acute chronic, and we're seeing all the big retail chains sort of moving in that direction, CVS, Walmart, and so on. And then upper right is for the Mayo Clinics of the world, but kind of the question I always have is how many of those do we really need? We have, where I am in Chicago, we have 6 places that do heart transplants. Only one does more than 25. Most do single digits. I can't think of a less efficient way to do it with worse outcomes. So I think when you think about how the market's reacting, it's reorganizing itself to sort of attack these buckets. And the more that we change the payment for care over to risk-based models and ultimately full risk models, the more important efficiency, price, outcomes will become. Which will put some of which, as you know, will put some of the ways, traditional ways that providers deliver care today at risk. You won't be able to get away with doing a crappy job and then getting paid more to fix it. So,
yep. True competition like other industries.
Yeah.
Yeah. So one of the things that I talk about often is this statistic that 95% of innovations that are brought to market fail to reach any adequate level of customer acceptance or profitability. And that's really not in healthcare. That's just overall across industries. And then you think about the additional complexity that layers in healthcare. Why do you think some, innovations fail and some succeed?
Yeah. Well, have you seen you've probably seen the curve of innovation. You got the early adopters and they're willing to try everything. And the key is to get to about 20% market share with whatever the new innovation is.
Yep.
And what's hard about that is that next group is they're called pragmatists or early adopters, and they have to have a business. They aren't going to just do it because it's cool to do. They have to have a business reason to do it. And so most companies that fail tend to fail in what they call that trough of disillusionment, where
crossing the chasm.
Yeah, crossing the chasm. So you just can't get there. So that's writ large in society or across industries. I think in healthcare, in some ways it's even tougher because we don't necessarily have companies that are purchasing based on value. They're purchasing based on how do I optimize revenues in a fee-for-service system.
Right.
And so coming up with a better solution, even if it's the best solution, doesn't necessarily mean you'll gain acceptance. Now, having said that, I did mention that record levels of private equity and venture money are flowing into the space, and they're still flowing into device and pharma like they always have, but the services and provider side are disproportionately benefiting. So I think the market believes there are all kinds of opportunities to improve. And one of the things you look like you're a millennial.
My daughter's 27.
Oh, okay. Well, okay.
I just have really, really good genes.
You are going to live to 102 like your grandmother. So, your daughter's generation then, when you think about that group, half of them don't have primary care physicians. They think hospitals are only for really sick people.
Yeah.
They only want care when they need it and only when they need it. And they want it to be on demand and a click away and really convenient. So I think there are a number of sort of millennial entrepreneurs that are coming in to fill that space. And this is the generation that taught us to ride with strangers and to stay in strangers' houses. And I think they're going to reshape the way we do.
Completely.
So the digital natives. And so I think there's a chance that healthcare could become or could exceed those rates just because there's so much room for improvement, and the opportunity to take technologies that have worked in other industries for consumers and apply them to healthcare is so vast, and people are doing it. So, and the current industry is not terribly good at it. So, so it's a disruptive moment.
So one of the things I think is really interesting is you just talked about the technology adoption curve, the diffusion of innovation, and as common as it is, it's very rare that I come across a health innovator that is basing their targeting strategy on that market segmentation. So it's still usually more of the traditional sense that they might be segmenting users versus, the buyer, or the doctor versus the health plan or the payer. But I rarely see folks go that step deeper that really becomes a game changer and foundational to their strategy going forward of not looking at the early adopters. And so they spend so much time with the pragmatists that you just talked about, trying to arm twist them and convince them that they have a problem that they can solve for them. And it's just kind of a mismatch of problem and solution, or awareness an interest to solve that problem at that point in time.
Yeah, there are two things I love about capitalism. The first is the ability to create something from nothing. So you're entrepreneurs. It's probably one of the highest forms of human achievement, and and people obviously gravitate to it.
Sure.
So that's great. I mean, my company didn't exist 6 years ago, and now it's a reasonably good little company. Hopefully, it gets bigger. And I'm that process of trying to figure out what the marketplace is, what customers want, how to deliver it, how to price it, how to respond to setbacks, how to seize opportunity, how to not be overwhelmed by opportunity. All those things are remarkably invigorating, but they're also hard. And I think that one of the biggest things that entrepreneurs fail to recognize, and I see this a lot, particularly with engineers and people on the tech side, the health tech side, is it really doesn't matter how good your product or service is. Ultimately, you got to convince somebody to buy it. And I do a fair amount of advisory work for early stage companies. And when I'm looking at companies, I'm now evaluating the CEO not only on their ability to, produce a great product, because I think most technically proficient people are good at design, and their instincts are to make it better. But it's that marketing component. Can you put yourself in the chair of the person across the table, really understand the problem they're trying to solve, figure out whether or not you can actually help solve that problem, and if you can, get them to agree to roll up their sleeves and work with you on that. Too many people just say, look at my great widget, and they haven't thought about how it fits into. So those that do, that can convince people to buy what they're selling, have really crossed the big threshold. So, all these, pre-money companies, or, they're going at it, they're working hard, but at some point you got to turn the potential into actual sales, and that's a hard thing to do. And I think that discipline is part of what makes capitalism work. Yeah,
absolutely. It's true. So many of the folks that we work with, think that because their innovation is technically or functionally superior than what's in the market, right? It's better. It's faster, it's more efficient, or it's cheaper. And even if they have demonstrated outcomes that it's better, it still doesn't guarantee success, right?
No, not at all.
Way too many times. So this kind of leads me to my next question. So what are some of the strategies that you recommend for health innovators to rise above the noise, especially with early adopters?
Yeah, well, I mean, you just heard a dose of it, which is really try hard to put yourself in the position of the person across the other side of the table that you're trying to sell to, and really understand what problem it is they're trying to solve and whether you have a solution. So I'll give you an example. When I was a banker, I would, for my first meeting, and maybe this was an indication that ultimately I was going to turn more to journalism, but I would go to a first meeting with just a pad of paper and a pencil, and I would interview the person. And if it was really important, I would write down what I thought the current status was and what they were trying to do, why they were trying to do it, what the goals were. And then I would let that person read it. And I could usually get it 75, 80% of the way right, and then get their input. And then at that point, we had a shared document that accurately reflected exactly, because they had contributed and signed off on it, what it was they were trying to do in terms of capital formation or acquisition or whatever it was. And then I would go back and think hard about whether we could help. And if we could, I would say, well, here's what we've agreed on. Here's what I think we can help. I don't want to be adversarial. Why don't we get on the same side of the table, roll up our sleeves and go at it?
Yep.
And I, Roxy, I could not get other bankers to do that. I mean, they always wanted to take their pitch book and, and I'd say, don't bring a pitch book. And they were reporting to me, right? Don't bring, there's the book. So what's that for? We're going to have a conversation. Well, just in case, So, I mean, I almost can't overemphasize that part enough. I think the other thing is appreciate, particularly if you're trying to sell into a health system or not, that even if you got a great point solution, somehow it's got to integrate into everything else that's going on. I believe ultimately we're going to move toward platforming in the same way Amazon does, that these companies will be somewhat agnostic about what they own and where they partner and where they outsource. But what they'll have in common is the ability to mix and match attributes so that they can design products that meet customer needs, built around brand and customer experience. So, having that narrow conversation without having a sense of how this could integrate into a broader service platform, I think is also a mistake that many fall into.
Yeah, I think so, especially for the latter part of the market. When the market is a little bit more mature, that whole product configuration and you don't have to be the one to deliver the whole thing, but being able to have those partners and making sure that it's going to be able to be fully integrated is really, really critical.
Yeah.
So it sounds like you've worked with large institutions that are trying to innovate within, and then with some early stage startups that are innovating externally. How would you describe the differences between those in the challenges that they face and how they overcome them? Yeah.
Well, I call the smaller ones the upstarts, right? And then you've got the incumbents. And I like the title of the book is The Customer Revolution. So we got upstart revolutionaries and incumbent revolutionaries. And the challenge for the upstarts are what we've been talking about, which is getting access and sometimes resources. The incumbents, are already market leaders. They have a whole different set of problems, usually related to the fact that what they're getting paid to do is different than what they say they want to do. So you say you want to put patients first, but if I look at what you do rather than what you say, it still takes a month to schedule an appointment. You don't have customer-friendly software. You don't follow up terribly well. All the things that we're very familiar with as consumers in the healthcare system. I very rarely see a disconnect between what a small entrepreneurial company says it wants to do and what it's doing, that those are perfectly aligned. I often see a disconnect in healthcare between what a big incumbent company says it wants to do and what it's actually doing.
That's good. Great observation.
Yeah, no, it's I used to love the show Dallas. You probably remember it. And there was one episode, it was a long time ago, obviously, where JR, the main character, was scheming with his brother Bobby back and forth, and finally JR said, Bobby, once you give up your integrity, the rest is a piece of cake. And I think in healthcare we've got sort of this built-in hypocrisy in a lot of what happens, because we've got this kind of artificial way of paying for things not related to value, just related to volume. And that's what everybody does to sort of keep the machine going and earn a great living. But they know that's not the right thing to do, so they talk about all the value stuff they're doing. But, if you're 98% fee for service and you got one person working on social determinants of health, that's probably not going to get the job done, right?
Right.
So what I am on the incumbent side, what I've seen for really successful companies is this concept of dual transformation. Have you heard of this? So you've got the existing business and then the new business.
Oh, yeah.
And so call the existing A, and you run that as efficiently as possible. And then B is whatever the new business is. And I'd say, broadly speaking, in health, healthcare is A and health is B. If you're going to try and compete on health, that's very different than trying to compete on healthcare. And yet, if we're going to go to population health models and vertical integration, you're going to have to compete on health. And then you've got this sort of C level up above, which kind of settles the jump balls and makes sure resources. But essentially, A does A, and you don't mess with that, and B does B, and you don't mess with that, and let them go about their business. And an example of that would be the Fairview Health System, Fairview University, Minnesota Health System, which is just opened a system operations center. They used to have 600 ways of calling into Fairview. Now there's one center, so one call does it all. They've also got some predictive analytics that sits in this building with a bunch of screens. They can anticipate where bottlenecks are going to occur, and then they can send a nudge to a nurse to get a discharge out earlier, and it's bringing down length of stay. It's improving. That is kind of classic A business. How do you run it better? Yep. And simultaneously, they've created this company within a company to handle all the risk business. So they've got a little bit of an insurance company. They've got physician groups. So all that care management activity isn't trying to succeed within the fee-for-service kind of treatment environment. So they really are competing on healthcare in A and competing on health in B.
Different budget, different culture, different goals. Yeah.
Absolutely. You completely understand. And so it's really hard to do. But I think if you try to do both inside the same company, it fails. It's just, like when Kodak tried to do digital photography inside the film business, and film ate digital for lunch, and ultimately, choked on it. So
it's just one roadblock after another. So who are some of the health innovators out there, both large or upstart, that you think are doing it well?
Oh, there are lots. There are lots of them.
Who can we learn from?
Yeah. Well, and some of the partnerships are kind of interesting too. There's a company called Grand Rounds out of San Francisco, Silicon Valley funded, and they started as doing second opinions. So they collected a network of top 1% specialists around the country. They would contract with employers who would pay per member per month. One of their employees would get sick. Grand Rounds would come in and look at the diagnosis and the treatment pattern, and about 2/3 of the time would change it, and usually change it in ways that were less intensive. And that's a great service, but they have now kind of migrated more into the primary care space, and they have an algorithm that literally ranks every primary care physician in the country. And what they've discovered is that higher performing primary care physicians get the referral patterns right the first time, and get the prescriptions right the first time. So, for example, 70% less opioid prescriptions. So Grand Rounds is now partnering with Walmart and they're going to roll out this service. So when a Walmart associate needs primary care, they will have their ability to look at all of the primary care physicians in that region and direct the associates to these higher performing primary care physicians. And the belief is, and it's already started to prove itself out, that they will get better care, what we all want, better outcomes, right, lower cost, better customer experience. Comcast is doing something with a similar company, different from Grand Rounds, but another upstart company called Crossover that does on-site clinics, nearby clinics, and now virtual clinics. And Comcast has 180,000 people nationwide. So they're going to run all of their employees through these crossover clinics where they have a lot of people. They'll have it, on site, where there are a reasonable number. It'll be nearby, and otherwise it'll be virtual. But it'll be one platform, integrated, great care, and Comcast for a long time has had some of the best outcomes of any of the corporate buyers. So part of what I think is happening is that the people that buy healthcare, government and self-insured employers, are starting to demand more value from the system. Demand-driven change, superhero results. It's a little like, McDonald's is experimenting with kale salads, not because they don't want to sell you more burgers. It's because some of their customers want some healthier options. Yep. And I've been waiting for this for a long time, but I think the buyers are getting smarter. And the only response many of the big systems have is to really use, market leverage on pricing to keep them in network. So as we get these new types of services, like the two I just described, that starts to break down. Your daughter's virtual care company will get her generation. And, I think the boomers too, people more like me than you, but you'll get there eventually, are not going to go quietly into that good night. So they're disproportionately buying Medicare Advantage, which is a capitated payment model. And ultimately, when you kind of get through it, you got to take care of a group of people for a certain amount of money. That changes everything. These MA plans, you get free hearing aids, gym memberships, dental care, all this other stuff coming in. And I think the boomers will also redefine end-of-life care. And I could go to any of these segments, and if you wanted to know a creative hospice company, I could give you a handful of those. If you wanted to know a company that was thinking about patient navigation in a coherent way, I could talk about that. If you wanted to know about a company that was figuring out how to pull data up and put it on a platform so that innovative companies can write apps, I can tell you about that. They're all over the place.
What's the pattern, Dave? What is the, if there is any, because what I think is interesting is the first two that you described in detailed, their business model involves the self-insured employer group as the buyer. Yeah. So they're able to circumvent a lot of the barriers that they might have to face if they were going into the traditional healthcare system. So what are, as kind of you think about it, are there any patterns to those examples that come to mind that we can glean?
Yeah, well, Roxy, the little slogan for my company, or the big slogan for my little company, like the little engine that could, is outcomes matter, customer count, and value rules. So I think what all these companies have in common are those three things: that they are focused on outcomes, not on process. They're focused on customers, not on any number of other things that you could worry about, and specifically on driving better outcomes and improving customer experience. And value, getting better outcomes for lower costs. So I would say every company that I would point you to is contributing to that in some way or another. I sometimes, if you can tell I like 2x2 grids. If you can imagine one, this one will be easier than the last one.
Let's do it.
Yeah, you got sort of market on the bottom. So you got bad market and good market, and then you got medicine on the y-axis, and bad medicine and good medicine. So in the lower left, bad market, bad medicine, you got fragmentation, You're paying too much. It's awful. If you're on the lower right, where you've got good market but bad medicine, that's like a reasonably priced MRI that you don't need. Even if it's just $500, you don't need it. It's bad for you.
Yep.
So that would be over treatment. If you go upper left, so it's bad market but good medicine. You need an MRI, but you're paying $5,000 for it. And those three, overpayment, fragmentation, and overtreatment, are the three faces of modern American medicine right now. Good medicine, good market, convergence, what I call revolutionary healthcare, right care, right time, right place, and right price. There are pockets of that in the country, but it's by far the exception, not the rule. So again, if you kind of come back to that outcomes matter, customers kind of value rules, that you're driving up into that upper right quadrant, healthcare cannot defy gravity forever. And we're not going to continue as a society to pay for care that doesn't generate the type of return it should and has enormous waste associated with it. So I think this is the way the marketplace is attacking it. The other thing that's happening is on the regulatory side. We've got a very progressive regulatory set of leaders at CMS right now, Seema Verma and Alex Azar, and they are doing everything they can to push transparency to level the competitive play. You may have seen last week they just came out with a new policy that says insurance companies and hospitals are going to have to, make it very easy to see what they charge, what their agreements charge. The industry is like having an apoplectic fit about it because they don't think they should have to reveal their prices. Well, guess what? When you have pricing transparency, you really empower people to make better decisions, or companies that act as proxies on behalf of people. So again, kind of a long answer to your question, but this is an industry that's, again, focused really on fee-for-service payment, churning volume, not really on outcomes, not on value. And, that's the old math. The new math is you're increasingly going to get kind of fixed payments for episodic care and capitation payments for population health, and you got a fixed amount you got to work with. So how do you take that money and provide great care and profit at the same time? So
sure.
Yeah.
So let's talk about outcomes a little bit.
Sure.
Thinking about a startup and their funding and their relationship with their investors or their board, and the amount of time that it takes to develop a program that demonstrates outcomes, the resources that are needed to back that. Let's just talk about that a little bit. What's your perspective on the money and the time that takes, and just this conversation of, it could take me a year or two before I have some demonstrated outcomes. I got to get some cash coming in, chicken or egg.
Yeah, no, it's, well, my first advice to entrepreneurs is bootstrap for as long as you humanly can. That when you have to take the outside money, it's very expensive, and they get a chunk of your company. And there have been too many cases where, because of a cash flow crunch, an entrepreneur that's really created a company with a lot of value ends up with a lot less of the pie than they probably should. So you bootstrap as long as possible. Husband resources. I think everybody's been a little bit kind of enamored of the Silicon Valley, where they just seem to hand out money like popsicles to companies, and sort of the attitude that we'll invest in 10, 9 will go bankrupt, but the one that we will be a big winner, and so on. I'm not sure those numbers are. It's a little like gambling. gamblers always tell you about the time they had the big win. They don't tell you about the 10 times they lost. So I sometimes
All
think,
those people that said no to Uber and Airbnb because
yeah,
they thought strangers were not going to ever come in someone's
right,
house, or
yeah,
we weren't getting in those cars.
yeah, yeah. Well, and Uber still hasn't made any money, which is kind of interesting. I
Right.
was just out at the big health conference in Vegas, and which is kind of got a tech investor focus to it. We're writing the report for the conference. I just finished the executive summary for it. And Uber and Lyft were there in a big way. Lyft was a 5-star sponsor. Lyft Health.
Sure. Yeah.
So
Yeah.
think about what Lyft could do to the paratransit industry or even the ambulance industry, to tell you the truth.
Absolutely.
Yeah. So it's
And they're already thinking about outcomes, the customer, and value. That's
yeah,
not something that they're
it's in
having
their
to
DNA.
learn.
Yeah, absolutely in their DNA.
Yeah.
So that's again, you kind of keep coming back to these same concepts. Demonstrating value, creating value, and then convincing others to pay you money to deliver it. It's really hard, but it's ultimately enormously rewarding. And I think that's and part of it is being lucky, right? Like Facebook was really lucky because Yahoo was it Yahoo? No, who bought MySpace? Maybe it was Fox. Anyway, somebody bought MySpace and kind of ruined it.
Right. Right.
And so Zuckerberg, and there'd been multiple attempts to try to do this type of social media connecting platform, and Facebook came along right at exactly the right time. When if they'd been earlier, they probably would have failed. If they'd been later, there would have been somebody else other than Facebook doing it. And timing is often as much a factor as hard work and ingenuity and so on.
Absolutely.
Yeah, I mean, again, I have a lot of friends in Seattle, and I wish more of them would just admit that they got lucky when they worked for Microsoft, and Microsoft went on its juggernaut. Which isn't to say they weren't smart and didn't work hard, but there are a lot of smart people that work really hard. But not everybody, picks a winner that way. So,
Sure.
luck is a big part of life, and recognize it, try to get it to come in your favor. Although I have always liked that slogan that luck is where opportunity meets preparation. So you got to be ready to get lucky.
Right. Hands down.
Yeah.
Not really one without the other.
Yeah.
So Dave, just one last question before we wrap up today. Most of our listeners are health innovators that are in the trenches right now with varying degrees of success and frustration. What advice do you have for them?
Well, on the frustration side, I'd maybe recapsule some of what I've said, which is bootstrap as long as you can. At some point, you probably need to take some money, but hopefully that's when you got a product that works and you're going to build out a sales force, that type of thing.
Yep.
The second is you got to be really concerned about the market positioning and the market messaging and the sales process. You can't spend all your time just making the product better and more beautiful and whatever. So that what I said earlier about having some marketing chops so that you can go out and convince somebody to put a piece of their business in your hands.
It drives me insane how many innovators spend millions of dollars on the product, and then they want to invest about $35,000 in their communications and go-to-market strategy.
Well, there you go. So when I was a banker, and we'd have these, beauty contests, what they used to call, where you'd go in and make a pitch, oral presentation, and you'd be one of three or one of five, and somebody was going to win, and others were going to lose.
Yep.
And it used to amaze me, Roxy, how much time people would spend cultivating a client, writing a proposal, doing all of that stuff. And then they would wing it in the oral interview. And I used to say to my team, it should be exactly the opposite. If you're one of 3 finalists, your chances of winning are all other things being equal, are third. If you over prepare for that, rehearse, figure out what the message is going to be tight on your transitions, have good graphics, all of that stuff, chances that you're going to win are going to be much better than if you go, and people, I can't tell you how many times they'd go into the book like this thick and they'd flip through pages and they'd lose and wouldn't ask for the job business. And I think those same lessons apply in any company, that's got a product, a service, and a market. And the point of sale, in those moments, you got to have your A game on, and you got to look your best, and you got to have candy, and it's a matchmaking process.
Sure.
And people that sort of don't either recognize that or don't give it credence are just not going to be as successful, and they'll be frustrated that others who are better at that don't have as good a product.
Absolutely. Yeah. How is this possible? My product is better.
Yeah.
It's more efficient. It saves more money.
Yeah.
But they tell a better story.
Jimmy Carter said the world is not fair, and he was right. So
That's true. That's true. Well, Dave, thank you so much for sharing your wisdom with our listeners today.
Yeah.
How can folks get a hold of you?
If you go to the website, foresightshealth.com, that's the number 4, or like my nephew does, he goes Foresight. So number 4, SIGHTHEALTH, foresightshealth.com. You can sign up. We do we produce a ton of thought leadership. There's a huge backlog of stuff that we've written. So there. You can also write to us there and so on. And I'd encourage people. I hope we get a few new readers out of this. We also do podcasts like you do. And
yeah.
Although I do like the video thing here. We only do it audio. So. So that's the best way to get a hold of us, and we're always eager to receive feedback, and also tell this is my edited version, right? Because you can see.
Yeah, you got to promote the book.
Yeah, go out and buy The Customer Revolution in healthcare. It's doing really well, and I think a lot of what we've been talking about is baked into that, and so people will enjoy that as well, or maybe use it. I've gotten lots of compliments on its ability to answer some of the questions that we've talked about today. So.
That's great. That's awesome. Well, thank you so much for joining me today.
Thank you.
What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization, and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.